Heart Failure Diagnosis Part 2, BNP, ECG, echocardiogram. What do those tests mean? These are the 3 key tests that must be done in every patient with heart failure. Good morning and welcome to today's episode of the Heart Failure Awareness Series. Today we will discuss 3 essential tests that help us diagnose heart failure and what each truly means. These are the 3 key tests that should be done in each patient with heart failure. The first test is a blood test called a BNP or NT-proBNP. When the heart muscle is stretched or under pressure, it releases special hormones called B-type natriuretic peptide or N-terminal proBNP. These biomarkers are specific for heart failure. BNP is to heart failure what a random blood sugar is to diabetes. They help us confirm or rule out heart failure. They also assess the degree of severity of heart failure and monitor your response to treatment over time. It is a simple blood test. There is no fasting needed and results come back quickly. Heart failure is very unlikely when the BNP or proBNP are normal. If your BNPs are less than 35 or proBNP less than 125 in a stable patient, or if less than 100 or 300 in acute heart failure can be ruled out. These numbers don't tell you the whole story, but they guide us to do further imaging tests like the ECG or echocardiogram. So remember, the specific blood test for heart failure, BNP or proBNP. Test number 2 is an ECG or an electrocardiogram. These are small electrodes that are placed on your chest, arms, and legs to record your heart's electrical activity, monitor the rhythm. An ECG helps us detect irregular heartbeats or arrhythmias, silent or past heart attacks, weakened heart chambers, strain from high blood pressure. It is safe, it is quick, and completely painless, and no electricity enters your body. So think of it as your heart rhythms selfie. And remember, it is rare to have heart failure with a completely normal ECG. So if your ECG shows any abnormality, your doctor will likely recommend an echocardiogram as the next test. And the third and very important test is an echocardiogram or echo test. This is the gold standard to diagnosing heart failure. It uses harmless sound waves, the echo, that shows your heart in motion. It shows how your heart beats, how it's pumping, how well your valves open and close. It can also tell if there is fluid around the heart or if some areas are not contracting well. And most importantly, it measures your ejection fraction, EF, a number that represents how strong your heart is pumping. I'll discuss about EF more in the next episode. An echocardiogram is safe. There is no radiation, there is no pain, just a bit of cold gel on your chest. So when your doctor says the next time we'll do an echo, please don't panic. It is just a way of assessing the heart, which is harmless. Basically, a detailed ultrasound of the heart. And these tests help us to diagnose if heart failure is present, what is the severity, and what are the underlying causes. So stay tuned for tomorrow's episode when I will talk more about the ejection fraction. What does it mean when your doctor says your EF is 30%? You have HFpEF. So we'll discuss EF, ejection fraction, in details tomorrow. So stay tuned, don't miss the next episode, and share this post to help someone. Dr. Beatrice Muthui-Mutua, saving lives one heart at a time.